Testing visual acuity. Measuring how well a patient can see is a vital part of the eye examination. It can help with diagnosis and help in determining if an operation, such as cataract extraction, might be helpful. Most importantly of all, however, it tells us about difficulties the patient may experience in their everyday lives. We can test visual acuity for distance and for near. There are also special tests that enable us to test children's vision. We will also demonstrate these. Measure distance visual acuity first, ideally indoors, but the test can be performed outdoors if required. Commonly, a Snellen's chart is used. This is situated 6 meters from the patient. It is very important that the distance is accurately measured. It should be evenly lit. There should not be bright light, such as sunlight, behind it, as this will cause glare and make the letters more difficult to see. The patient initially wears their distance glasses, if they have them. Each eye is tested separately. The eye not being tested is covered by an occluder. The patient is asked to read out the smallest letters they can see. Vision is recorded as the distance between the chart and the patient over the line read, less any letters the patient failed to see or got wrong. So 6/18 minus 2 with glasses means that the chart was located 6 meters from the patient, who was wearing glasses, and could see letters on the 18 line but missed 2 of them. The test is now repeated with the patient looking through a pinhole. If the vision improves, this may indicate that the glasses need assessing, but it may also improve vision if the patient has an early cataract. A pinhole is also useful in assessing the vision in someone without distance glasses. First, measure the vision unaided and then repeat the test with the patient looking through a pinhole. Again, a difference may indicate that the patient needs glasses, but look too for a possible cataract. For patients unable to read, an E or C chart can be used. The examiner points to a line and the patient indicates which way round the letter is printed. With the patient seated comfortably, they hold the test type book in their hands at a comfortable distance from their face. They wear reading glasses if they have them. The book should be well illuminated. Again, each eye is tested separately, but it is also useful to see if near acuity improves when both eyes are used together. Reading vision is recorded as the smallest type the patient can comfortably read. Measuring the vision in children can be more complicated. All testing should be carried out in a well-lit, quiet area to minimise distractions for the child. Until a child is 6 months old, vision is assessed as the ability to fixate and follow an object, such as a brightly coloured toy or light. Each eye should be tested separately and the reaction to occlusion noted. If there is equal objection to occlusion of either eye, this suggests that vision is similar in both eyes. If there is more objection to occlusion of one eye than the other, this suggests that there is a difference in vision between the 2 eyes. From approximately 8 months, the ability of a child to see sweets and cake decorations gives an estimation of their vision. Each eye should be tested separately. If the child can see the small object, he will reach out for it. If he cannot see it, he will feel for it. Between 6 months and 3 years, preferential looking tests, if available, can also be used. An example of this is the Cardiff card test. These tests are based on the idea that a child prefers to look at a picture rather than a plain card. The pictures are graded using the same scale as the Snellen's chart and are printed on the back of the cards. The card is presented at 1 metre or 50 centimetres. An object is either at the top or the bottom of the card, with the position initially unknown to the examiner, and the direction of the child's gaze is noted. When the examiner is unable to detect the position of the object from the child's gaze, the child is assumed not to have seen the object. The size of the smallest picture seen is recorded. From the age of 2, matching tests can be performed with the child matching a picture or shape positioned 3 metres away with those on a card in their hand. Initially, charts with single pictures of different sizes are used. K pictures or LEA symbols are examples of this type of test. The Sonksen Accuity test is similar to the Snellen Accuity test with a line of letters to match. The size of the smallest letter or symbol is recorded. The methods that have been described for assessing vision in children can also be used and adapted for adults with learning disabilities. The measurement of visual acuity is important in determining not only diagnosis and the possible effective treatment, but also how visually disabled a patient is and what the likely effect this will have on their life. It should be measured carefully to make these simple tests as accurate and useful as possible.